I'm Tom Cooney,
And I'm Crystal Faulkner.
and this is Business Wise. Our guest today is ChrisMihin. Chris is an account executive with Haran. Chris, a lot of people have questions about health savings accounts. They've become very popular because they go in sync with high deductible plans. It's a way to help even out the budget for your healthcare costs for a lot of people. For affluent people, it may be a way just to save money for future health care because they don't necessarily take distributions from their plan. But what happens when you reach age 65 and start getting Medicare? Can you still contribute to a health savings account?
Yes, you can. It really does depend if you are enrolled in any part of Medicare. If you're eligible based off age at age 65, you could still contribute as well as your employer can contribute as long as you're not enrolled in any part of Medicare.
So that means you can't be getting Medicare benefits.
Correct.
Well, Chris, nowadays a lot of people are working past age 65. Well, in fact, the normal retirement age for people nowadays is starting to be later than 65, even for Social Security purposes. So what happens if you're still working, you're still covered by your employer plan, maybe you don't need Medicare? How do you sync that with your employer health plan?
Well, I think what you do first of all is you have to educate yourself on when's Medicare going to happen, what are the things that you have to do, or at least research when you turn 65. Like you said, the HSA type of high deductible plans have been gaining steam over the last 10 years, and that might be the only thing that your employer offers you. So if you're turning 65, I think the first thing you need to do is to talk to your human resources professional at work and just kind of talk to them about that. You could definitely call our office and really help you understand what you need to do or not need to do. But if you're not enrolled in any part of Medicare, you can continue that financial funding.
Chris, just switching gears a bit, and again, I'm not 65 yet, so I've not had to deal with a lot of these issues, but I do think it's very confusing for people. You hear so many different types of Medicare. So there's Medicare supplements, Medicare Advantage plans. How do you know which is the most appropriate for you?
Now, when you fast forward and now that you're saying you're retiring and you're losing your group benefits, you are going to have two options. It's either going to be Medicare supplements or Medicare Advantage plans. Now, the first thing you have to understand is that is not from the government. The only part from the government is Medicare A and B, which they call original Medicare. The supplements and Advantage plans are purchased through private insurance companies. So again, you will get a Medicare and You book every year, about 135 pages, that kind of outlines what is a Medicare policy supplement, what is a Medicare Advantage plan. You're definitely going to have to do your research, talk to an advisor, or call the insurance companies direct to really see what is best for you.
So these plans are in addition to Parts A and B?
Correct. Medicare A and B was meant to be a base coverage when they were put together in 1965. So they have had supplements almost as long as Medicare's been around, and Medicare Advantage plans came about in the early 90s. So there are things that either supplement Medicare, which they don't pick up, or replace Medicare.
We've been talking to ChrisMihin. Chris is with the firm Haran. And Chris, you've been a wealth of information, but if folks listening would like more information, how can they reach you and what's your website?
Again, the website is www.haranassoc.com, HORANASSOC.com. And our direct phone number is 513-794-2960.
For Business Wise, I'm Crystal Faulkner.
And I'm Tom Cooney. We're with Cooney, Faulkner, and Stevens, your business advocate.